So obviously we're running a little late because we have so much great stuff to talk about, which is wonderful. But we do have some people from the public here who might want to make a few comments who've spent the whole day waiting. So is there anybody who would like to make a comment? If you do, please identify yourself.
And I'll bring you the microphone.
I'm Claudia Davis, and I'm with the Center for Equity at California State University, San Bernardino. And I have a question for David that's just about leaving. Oh, Ms. Erickson, yes. Okay, I just want to ask you a quick question. You had mentioned that in 30 years, we're going to end poverty. Could you address the homeless population, and how would we do that with the tremendous number of individuals that are homeless, individuals and families, please?
That's a really powerful way to start. So you've got, I think it was interesting the work that Malcolm Gladwell did around $1 Million Murray, right? This idea that sort of it's expensive not to treat this problem in a more compassionate way. So I find that that's a place where there's a lot of models of supportive housing to get people sort of stabilized, to have case management. I was surprised to hear, just recently we had at the Federal Reserve Bank of New York one of these meetings where we brought together health and community development, and a woman from United Health, one of the largest health insurance companies, said, we have abilities to sort of identify when people are beginning to sort of slip, for going from green to yellow to red in terms of and we can identify when we can intervene and keep them from yellow back into green again. But we need to create better partnerships with you, the affordable housing system, so we can be able to work as a kind of a case manager with you for our policyholders in your supportive housing projects. And similarly, at that same meeting, the head of CMS for New York State said, look, I have a waiver and I have $100 million I'm going to spend on homeless housing and high users of the medical care system for elderly as well. And he said, but I don't know who you are. I don't know who supportive housing people are. So that's just two examples where I feel like there's massive resources that are ready to be deployed to sort of get at this problem, because we know that if you stabilize people and provide them with proper medication, the proper sort of case management, that you can really limit this substantially in terms of the problem that exists today. We just don't have the mechanism to tie it all together. Sorry to be running off. That was sort of...
Good afternoon. Hello? Okay, hi. I'm Helene Calvé, Deputy Health Officer for Orange County. The four of us here are from Orange County Healthcare Agency, the local public health. So just want to thank you for letting us to be flies on the wall during your meeting. I think with the amount of brain power in this room, I could see that this report hopefully will be fantastic. We're all part of the Health Equity Committee for our local public health, and we've been working to educate our public health staff and community partners on social determinants, but the real missing piece, as you all know, is what to do about it. So I just looking forward to your report. Please be as specific, as scalable as possible. Please include not only what public health can do, but what all of our community partners can do, so we can really try to push the effort forward. Particularly difficult in a county here like Orange County. We're a very wealthy county, very conservative county, but we have many, many communities besides Santa Ana that are severely impacted by health inequities. Thank you.
Well, thanks for spending the time with us, and I'll just remind you that if you have questions that you don't feel were answered, you can certainly contact Amy, and she can. Yeah, whatever you do.
Jim?
I was getting called out, so I was sitting in the back. But since Orange County's here, just because I'm familiar
Shout
with
out
the work
for Orange County
on Waste Not OC, if maybe you could share just like a couple sentences of what Waste Not OC does as one of the community practices. Just like a few minutes for just like a minute or two for the group. And it's such a powerful overview. And with I'm actually one of the committee members, but I work with Eric. I work with the governor's office of planning and research. Waste Not OC is a great example of the community coming together with cross-sector collaboration. Since you were here, I was wondering if you could just share a few sentences about what it is that you're doing.
Waste Not OC, actually food recapture, as everyone knows, has been going on for decades. There are many, many organizations in the community that have been doing that. How this changed was to promulgate the knowledge that restaurants and businesses will not be held liable if the food they donate, is basically they can't be liable for anything that happens with that, and pulling together folks, so our environmental health who go out and do inspections at all the restaurants in the county to share that information with restaurants and businesses, arranging for transportation of food items, especially pre-prepared or prepared food that needs to be sort of gotten out there, and increasing the capacity of local food banks to get the food to those who need it.
Jim, just, this is Bashar Shukir, and it's so great to see local public health here from somebody who's been in local public health for so many years, and it's great to see the engagement. And I know Dr. Morita, who's the new health commissioner in Chicago, is not with us today here, but I'm sure she's very proud, and she'd love to share her Healthy Chicago 2.0 that was just released, that was focused specifically on health equity and what public health agencies could do to advance health equity. And if you go to cityofchicago.org/health, you'll see the Healthy Chicago 2.0 right there. So,
Well, thank you all.
I'll just do a shout out, as long as we're talking about public health agencies. We have so many folks represented on the webcast from public health, local public health, so that was really great to see too. So hi to all of you out there.
So I think we're ready for a break. Thank you.
So, yeah, so we're adjourned, and then we're going to move.
The official word is adjournment, and we'll move into the next session. Thank you.
That's what we were in this morning.